actually you're seeing there.
Okay. Good morning. My name is Sandra Schroeder. I'm the family nurse practitioner at St. Anthony College. I'm going to perform your lung exam. What is your name?
Natalia Markova.
Hello, Natalia. How are you today?
Fine.
Are you familiar with nurse practitioner role?
Mm-hmm.
Yes?
I am.
Okay. So I'm going to check your general appearance and well-groomed, alert-oriented, and I'm going to check the vital signs first. So first we are going to start by inspecting your respiration. So do you have any shortness of breath, trouble breathing? No. I'm going to note the rate, rhythm, depth. Should be soft, quiet, regular breath sounds. I'm going to look at the patient's color to look for any cyanosis. I'm going to inspect the lips. Okay, so around the lips, and I'm going to inspect the fingernails for any yellowish discoloration. I'm going to also assess for tracheal deviation. So I'm just going to locate trachea on one side between the trachea and the sternocleidomastoid muscle. So I'm just going to go in between the groove. So it's symmetrical. So trying to displace it so it's even. And I'm going to look for any use of accessory muscles. So I'm going to look at the supraclavicular lines here, but your breathing is pretty normal. There is normal work of breathing. Don't see any use of the accessory muscle. I don't see any retractions anywhere. We can also look at the abdominal retractions and subcostal retraction, but there is nothing. Okay, and I'm going also to so with the retraction, I will ask you to kind of take a breath, like try to breathe as you normally do. Okay. So what else do I need to do? I need to expose your chest a little bit, and I'm going to look at the symmetry, and we want to see symmetry of the thorax. So we are looking if there are any deformities in front or behind the patient. I'm going to compare the anterior-posterior thoracic cavity. It seems I don't see any emphysema, nothing enlarged. So respiratory movement is fine. So I'm going to palpate first. Sometimes when patients complain of the pain on one side, I can palpate. I can start palpating. We can actually start palpating on the anterior side. Okay. So I'm just going to palpate gently here, and we'll ask if there's any tenderness. We can also note for any bruising too. Any broken ribs that may have complaints of increased pain during palpation. So we are doing the same for the back. So I'm just going to palpate like that. Okay. So for the next test will be chest expansion. I'm going to place my fingers behind your back here, approximately here, and I'm just going to ask you to take a deep breath. One more time, sorry. Okay, good. I can see symmetrical movements. Well, since I'm on the posterior side, we can start at the checking your tactile frematus. So I will ask you to say the word 99. 99. Okay, perfect. And we can also do that on the interior side. We can ask you to okay. Perfect.
99.
99. Okay, perfect. So we are done with the palpation. The kind of vibration is good. I could hear this under my palms, so I have no concerns about that. So next we will do percussion. So we'll start with the percussion of the I don't know, maybe posterior side again. So we'll ask you to cross your arms in front. Okay. So I'm going to start here at the upper scapula. Perfect. Okay. So now we'll do the anterior side. Yeah. So we'll do the ladder pattern again, and we'll start at the here. Down the xiphoid process. We can do like that. And we can do below the breast as well. Okay. So right now we will do the check for diaphragm. I cannot say that.
Excursion.
Diaphragmatic excursion. So we are going to do that. We are going to percuss on your back. On each side we will do actually. And we'll just ask you to, okay, that's good. We'll ask you to kind of breathe normally now. We just want to know the change of the sound. Yeah. So now we'll do the same. I'll ask you to take a deep breath and hold your breath. Yeah. It's like around like 3.5 centimeters. So we'll do the same on the other side. We'll just breathe normally now. We'll note when the sound changes. And now take a deep breath. Hold that. Okay, so it's about the same on that side. So next we will try to do auscultation. We will listen to the sound. We can do the anterior side first. Yeah, we'll start here. Below your clavicular line here on this side. Okay. We're looking for pitch, intensity, and duration of expiration. Okay, good. Then ask you also to take a deep breath. I'm looking also to identify any adventitious sounds like crackles or bronchi. Okay, and now I'm going to go below. I'm going to skip the breast. I'm going to go on this side. This side. I'm going to listen under on the lateral side, mid maxillary lane here. Take a deep breath. So lung sounds clear. I don't see any sounds. And now we'll try to listen to the posterior side. If you can just turn your back towards the monitor. You can cross your arms in front of you. We'll start here. Right. Take a deep breath. Good. Your lungs are nice and clear. Okay. I don't hear anything. No concerns. From my part, do you have any concerns?
No.
Okay. So in case that there is some consolidation that we found, we would perform some tests to check for that. One of the tests is the test that E changes into A, and when there is like consolidation, then the E kind of sounds like an A. We can also do like the other test, the whispered pictoroloquy. I cannot pronounce that word. And this is when patient whispers 1, 2, 3, 1, 2, 3. And then we listen with the stethoscope, and the sound actually, there is like an increased sound. Instead of the whispering, we hear the loud sound. And of course, the sound, the word 99 that we did with the Fremitus, the test, we also feel for the vibration or the muffled vibration, then it would be like positive for consolidation. So I think that concludes our today assessment for respiratory, lungs, thorax part. Thank you, Natalia, so much for participating, and thank you.